one of the major levers that I've been able to really see huge shifts in people very quickly is this, crazy blue compound out there called methylene blue. And it's an old compound, but really repurposed for mitochondrial support. And so methylene blue has been studied at these higher doses as an antimicrobial and has, fantastic capacity for that. I had him taking methylene blue every 4 hours, 32 milligrams of methylene blue every 4 hours, and he cut his time down by 3 hours the following year.
Wait, say that again. By 3 hours?
By 3 hours, yeah.
A certain dosage leading up to an activity, during an activity, after activity. Is it activity specific, or can I just begin to rotate it into my, let's say, my healthy habits, my key supplementation, and just then go about my norm and then see and feel these benefits?
Think about it. If you're on the performance side of things, even sort of regular day-to-day optimize and not elite or anything like that, you're going to have more stress on various days. Sometimes that's going to be physical stress. Sometimes that's going to be cognitive stress. And that's where methylene blue can be really actually quite powerful. And you can use it for those higher and those bigger endurance days. You can do it for those bigger days at the gym in general, because I've been actually testing this with a couple of colleagues where it seems that even during anaerobic work, you can recover at a higher heart rate if you have methylene blue around. Hello, my name is Dr. Scott Sherr. I'm the Chief Operating Officer of Troscriptions. I'm an internal medicine physician, and welcome to EverForward Radio.
Please take us into this methylene blue world and walk us through why are people choosing to dye their tongue blue to support longevity mitochondria?
Or at least their urine, if they're not, they're going to go with their mouth.
Yeah.
The thing about methylene blue is that it concentrates in the body in the urine. That's how you excrete it. And so if you do take methylene blue, you will have some blue urine. And so there was even songs about this. You'll like this back in the World War II era, where in the Pacific, if you were being shipped over there, you had to take methylene blue prophylactically to prevent microbial infections. And they had songs about singing blue in the loo, peeing blue in the loo. I almost got it. Peeing blue in the loo. Yeah.
Wow.
So methylene blue has been around a long time. It's been around since the 1870s, actually, initially as a textile dye to dye blue jeans blue. But in the 1890s, it was realized that it was a fantastic anti-infective at higher doses. We use much lower doses now for mitochondrial support, but back then, it was the first antimicrobial around. And so it's used for urinary tract infections, used for fungal infections, viral infections, and, secret, we actually are using it for all those things again now, because a lot of those antibiotics and antimicrobials don't work as much anymore. Or at least it could be supportive in the capacity of using them in conjunction, using less of them if needed. But malaria was actually the infection that was most primarily addressed by methylene blue. And that's why it actually got its first designation as the first drug registered with our FDA back in 1897 as a treatment for malaria, actually.
Wow.
And so even now in developing countries, it's still being used as a treatment for malaria because a lot of those drugs don't work, as I was mentioning earlier. But up until the 1950s, it was actually the premier antimicrobial around until penicillin and penicillin derived drugs came around after World War II, actually. And so that's why it was used by World War II soldiers. And then even in places around the world, in the Soviet bloc, in the USSR, they were still using methylene blue as an antiviral. So if you were a child in the Soviet bloc in the 1960s, 70s, and 80s, and you had a throat infection, like a sore throat, for example, they would give you methylene blue lollipops to suck on, and you'd paint the back of your throat with methylene blue. And our cells make hydrogen peroxide to kill organisms and to kill cells that they don't need anymore. And this is our suicide mechanism inside of our body, to release a bunch of hydrogen peroxide, kill a bunch of cells that are not supposed to be there, including precancerous cells actually as well. And so methylene blue has been studied at these higher doses as an antimicrobial and has, fantastic capacity for that. And after antibiotics and antimicrobials came around, methylene blue became less exciting for people to use because it had this potential side effect, making your urine blue, specifically that. And people love, like evolutionarily, we love fancy, sexy, or newer things, right? And so that's why the antimicrobials kind of came and took over. Now, if you're looking to use methylene blue as an antimicrobial, the most prominent place you'll find that still happening now is in fish tanks. And fish tank cleaner, the aquarium cleaner itself, actually has methylene blue in it. And I don't recommend you have or take or use any of that methylene blue yourself, okay? Because it's highly contaminated.
Yeah.
But it actually is an antiseptic for the fish. And that's why they actually use it in fish tank cleaner. It had a couple additional chapters of its evolution as well, methylene blue. Actually, the first antipsychotics were derived from methylene blue because in addition to having antimicrobial and mitochondrial benefits, which I'll talk about in a minute, it also increases some neurotransmitters, norepinephrine, dopamine, and serotonin. And it does it because it's called a monoamine oxidase inhibitor. And so the first antipsychotics were derived from it. And actually, funny enough, the first antipsychotic drugs were compounded with methylene blue, which means so if you were in a psych ward, you were getting a psych medication, it was compounded with methylene blue so they could check your urine to make sure you were actually taking your antipsychotic at the same time.
Wow.
They saw the methylene blue. And so it was used that way for a long time. And then over the last several decades now, it's gotten really cool because now we know it has this amazing effect in the mitochondria itself. And we talked about the mitochondria a lot, and we actually set this up very well because now you know that the mitochondria make energy, but you also have to detox from the energy that you make. And you also know that 94% of US adults have an issue with either making energy or detoxifying, right? And now where does methylene blue come in? It comes in the capacity that can help you make energy and also help you detoxify at the same time. So the problem with a lot of things out there is that some things will help you make energy, but if you help just make energy, just like with your pipe analogy, if you don't have the capacity to detox from that, you're going to feel crappy. And just other things are great as an antioxidant, but they don't have the capacity to help you make energy. So methylene was very, very special in the case that it does do both, and it can compensate for dysfunction in that mitochondria on those complexes on the mitochondria that I mentioned, the electron transport chain. And so many of us are having so many issues with making energy because of these issues. And so a great example of this that you'll enjoy, I think, is something that I hope none of you ever have to have, which is to be poisoned with cyanide.
Yeah, I'll jump on that. Ditto. Hopefully
not. Right. So cyanide.
I don't know how many spies we have listening. Maybe, I don't know.
Yeah. So the antidote for cyanide poisoning is methylene blue, actually. And because what cyanide does, it destroys one of the complexes on your mitochondria that helps you make energy. One of the final complexes, actually. But what methylene blue can do in this case, it actually can bypass that complex. It can throw electrons in different locations. It can help you maintain electron flow, even to a small amount, even with cyanide around. And so if you are going to a country where you might be poisoned with cyanide, please bring your methylene blue with you. Just, PSA, public service announcement for everybody.
All right, note taken, adding that to the carry-on for next overseas travel. Yeah, we'll see.
Please, yes. I mean, especially for you, Chase. I'm just kidding. I don't know. But the deal there is that because you can compensate for almost any aspect of mitochondrial dysfunction using methylene blue, you have this huge capacity to help a huge swath of people very, very quickly feel better from a energy production and detoxification perspective. So less brain fog, more energy, better attention, better musculoskeletal function, less pain in your muscles and your joints. And I've seen this like time and time again in clinical practice. I could tell tons of stories about this, people that were just feeling terrible. And then 3 to 5 days later, starting methylene blue, and they feel like a different person. One lady I can remember with mold poisoning. So she had mold in her house and she had mold in her body. She remediated the mold in her house. She remediated the mold in her body using various things, but she still felt terrible. Why? Because that infection had significantly caused mitochondrial dysfunction. We gave her 3 to 5 days of methylene blue. I can't remember if it was 3 or 5 days, but she was literally back to work after being 2 years out of work, just starting low doses of methylene blue. And that's the final sort of chapter where we are now with methylene blue. It's very low doses of it, 5, 10, 15 milligrams, like up to about 25 milligrams of methylene blue. So these low doses are fantastically supportive on that energy production side and also on the detoxification side. So your patients with chronic inflammatory issues, chronic complex medical illness, your long infections of various sorts that aren't getting better, these are mitochondrial issues as well as maybe other things as well that need to be addressed. But the mitochondrial piece, if you can start supporting right now, while you're even on that longer path of optimizing your health, it's a huge amount of potential to help people in the immediacy so they can get to the place where they actually can do some of the harder work of optimizing over the long term.
Who do you think methylene blue is best for? Is it just for someone like you were describing who is experiencing these inexplicable, ongoing chronic health issues, whereas they've maybe tried everything else? Is that the case? Or the everyday wellness goer? I keep thinking of someone like myself my audience here that, again, we're doing pretty well. Maybe we're just looking to optimize. We don't have really any, quote, health problems. Is this for the everyday user, or do we only need this when, things are at their worst?
Yeah, it's a great question. So what I often say here is that some people need methylene blue for a lot of the time, and some people need methylene blue just some of the time, depending on what it was actually doing in their life that's causing more stress that increases their potential for need. And like on the performance side, it's important to also mention that methylene blue can act just like oxygen in your cells, which means it can be the final electron acceptor to help you make energy from that energy production capacity in your mitochondria for longer. So what does that mean is that it increases potential for endurance, your aerobic capacity. There's actually been studies in a couple animals and dogs that it increases your time to reach lactate threshold, meaning that you can go longer before you reach it as well. And so from an endurance perspective, I'm using it that way and I'm seeing fantastic benefit. And a good example of this would be a gentleman that I work with that did the Leadville ultra marathon here in Colorado.
Leadville 100, right? It's a 100-mile race. Yeah.
100-mile race. Yeah. And so he had done it the year before, but he hadn't done well in various ways. He'd finished, but he wanted to do better this year. So I had him taking methylene blue, both the just blue and the blue cannatine, the ones you were just showing, every 4 hours, 32 milligrams of methylene blue. So 2 boxes of the just blue and 1 box of the blue and 1 blue cannatine, every 4 hours. And he cut his time down by 3 hours, the following year.
Wait, say that again. By 3 hours?
By 3 hours. Yeah.
Just by keeping the same training protocol, everything else, I'm assuming the same to some degree, but you just had him rotate in methylene blue?
That was the big lever for him. The other piece that I did for him, because, he was doing a lot of other things, is that he had diarrhea the year before. And so we were able to do some things, to help him so he didn't have diarrhea as well. It's very common in these long races that you get diarrhea. If you've seen people crap themselves when they run a marathon.
Oh, yeah. That you lose bodily function. Yeah.
It's common. And the reason for this is kind of a sidebar, but I think it's kind of a cool, interesting note for your crowd is that you are shuttling all of this particular amino acid called glutamine from your small intestine to your muscles to help try to maintain muscular function. Glutamine is the primary fuel of your small intestine. And so if you shuttle all of this glutamine to your muscle, you don't have enough for your small intestine. It causes a huge amount of inflammation because the small intestine can't keep up with its energy production. So you get a lot of diarrhea. You get leaky gut. You get like an instant leaky gut when you're doing these kinds of races. And so we gave him glutamine as well. So he got the glutamine along with his training program was relatively the same from the previous year. So glutamine and methylene blue. Those are 2 major things that we did for him. And that was what he was, that was the result, 3 hours less.
That's insane. Time. I mean, any endurance person to hear, hell, I think a lot of people would take 3 minutes shaved off like your run time, but 3 hours, that's insane. Okay. So now it makes me think, I'm again, the everyday person. I'm not doing the Leadville 100, but sure, I am interested in getting some performance benefits, recovery benefits, just my day-to-day norm, my wellness goals benefits. Is methylene blue something I need to really specifically use? And what I mean by that is a certain dosage leading up to an activity, during an activity, after activity. Is it activity specific, or can I just begin to rotate it into my, let's say, my healthy habits, my key supplementation, and just then go about my norm and then see and feel these benefits?
Think about it. If you're on the performance side of things, even sort of regular day-to-day optimize and not elite or anything like that, you're going to have more stress on various days. Sometimes that's going to be physical stress. Sometimes that's going to be cognitive stress. And that's where methylene blue can be really actually quite powerful. And you can use it for those higher and those bigger endurance days. You can do it for those bigger days at the gym in general, because I've been actually testing this with a couple of colleagues where it seems that even during anaerobic work, you can recover at a higher heart rate if you have methylene blue around.
Meaning strength training, weightlifting.
Strength training.
We're not on a treadmill, we're not running and not aerobic.
Yeah. So a friend of mine, we've been working on this where it looks like, and there's no studies here yet, but the idea is that like when you're doing weight training, you're trying, between sets, you're trying to bring your heart rate down to a certain amount so that you have more sympathetic reserve. You can actually lift heart more that next set you're going to do. And what we've realized, if you have methylene blue on board, you don't need to go down to as low of a heart rate to do the same kind of work, which is interesting because I think it's because you're supporting that whole system, both on the energy and the detox side, so that you have more capacity, which is super cool. And so you can do more as a result of that. I'm sorry to interrupt, but I don't think like people really need to hear that. Like really
just think about what that means. You don't need to allow yourself to go down to a lower heart rate to begin your next set, to begin your next workout. You're hijacking all the benefits of aerobic and anaerobic right there. So you're getting the heart health benefits of keeping your heart rate elevated for a longer period of time, cardiovascular benefits, so many other benefits there. And then also you're able to move the same amount of weight in theory here, we're saying. So you're keeping strength training up, muscle endurance, myofibrillar integrity, sarcoplasmic integrity here. So muscle size, muscle density, even hypertrophy. You're able to stay on track with that routine, but get the benefits of the other. That's profound.
Yeah, that's very well said, because that's what's kind of really nuanced about methylene blue, because it has that capacity on both ends, right? It has that energy and detox at the same time. So, and you're getting the capacity to potentially recover at a higher heart rate, which is really great for an anaerobic workout. Also
for people like myself that don't want to do cardio. So we can keep our heart rates up. I'm not saying this is a replacement for cardio, but again, stack these up over a long period of time, keeping your heart rate elevated for longer periods of time. You're going to get those cardiovascular benefits and all the other cascading downstream benefits as well.
Yeah. And I have a couple of my patients that refuse to not do their workouts with methylene blue because they can keep their heart rate up longer for a longer period of time. Right. And so I have a lady does the treadmill in the morning. She's like, Dr. Scott, she's from the South. She's like, Dr. Scott, I won't work out without that stuff. And I'm like, well, that's fun, but at the same time, I think if you're pretty well optimized, it's not something you should be taking probably every day. It's probably something you should be using, periodically when you have more stress, when you're doing higher endurance work, you're doing higher performance work, and then taking a break from it as well. I think that's probably the best way to do it. There's really very little risk, I think, over time, even especially at lower doses. But I think at the same time that the up and down, sort of the oscillating with the methylene blue is likely best from a cycling perspective.
I was just going to bring up,
you're well optimized.
I was just going to bring up cycling. Yeah, I think like some people, well, nowadays, I think creatine, we're seeing a lot of evidence showing that cycling isn't really as much of a thing as we need, as we thought it used to be. But some people still do. Myself personally, I'll cycle through certain supplements, certain times of the year. Like once a year, I'll go off everything entirely for a month. Again, my personal choice, my personal goals here, but cycling, I think, is a very important concept because certain things can build up resistance. Certain things can actually cause your body to stop producing them, like hormones, at the same level or certain levels. And, like people who are on testosterone replacement therapy unnecessarily, people who take frequent high dose melatonin unnecessarily, these immunomodulators and downregulators, basically. So it's important to cycle things. Where I'm going with that is what would be the cycling protocol? This might be super relative person to person. Should I take, 3 of my 5 workouts on it and, 2 off? Or should I, let's say I'm not really the most active person, but in the boardroom, I travel a lot. Should I only save it for, these life cycles here, quote, air quote, life cycle, of only when I'm traveling long-term, only when I have this big presentation? Walk us through the cycle aspect of methylene blue.
Yeah. So if you're pretty well optimized already, you might want to think about using it maybe 3 to 4 days a week when you really need it the most, and using your lowest dose that you need during those days, depending on what you're doing. For me, what I often talk about with sort of people that are more optimized is that I like everybody to start off at a low dose, like 4 or 8 milligrams, and then increase their dose every 3 to 5 days in a row until they find a dose that really works well for them. And that's a dose that they're going to take as needed for their bigger workouts or their bigger levels of stress that week. And so for their bigger endurance, for their bigger anaerobic work, their bigger, strength training, but not every day, right? So maybe you do it 3 days a week on tops kind of thing, maybe 4. And then you found that dose because you've kind of titrated in the beginning, like what's the right dose?
Right.
Right? And then if you're keeping the dose low in patients that are sick or that need more chronic support, like you can actually give people methylene blue every day at low doses. Once you get to be like above about 30 or 40 milligrams a day, that's when I typically recommend at least cycling it off 1 day a week. And then if it's higher than 70 milligrams a day, then taking at least 2 days off a week. And there are some patients that I work with that do need to be on higher doses of methylene blue for like significant mitochondrial support or significant anti-infective capacity as well. And sometimes for long periods of time. And so they have to be more supported, and they have to be, looking at cycling a little bit more intentionally. But the as needed aspect, if you're relatively well optimized, is maybe 3 to 4 days a week. And if it's not from a performance, physical performance, from a cognitive performance perspective, you mentioned travel, for example. Travel is a really great time to use methylene blue, because methylene blue, again, can work just like oxygen in the cells. And when you're on an airplane, for example, you're at actual pressurization of about 6,000 to 8,000 feet. Meaning, so when they pressurize the cabin, they close the cabin door, you're instantly pressurized to about 8,000 feet above sea level. So most of you that are listening live at sea level right now. And that's 21% oxygen in the air. The rest is mostly nitrogen. If you're on an airplane and you're now at 8,000 feet instantaneously, number one, this is why many of you feel tired as soon as they close the cabin door on the airplane, is because you're just pressurized to 8,000.
There's no acclimation. It's immediate.
No acclimation.
Yeah.
Right? So you go from 21% to about 16 to 17% of oxygen right away. And so your body goes under stress mode right away, even though you feel tired at the same time, because you're less oxygenated, you're less energy being made. And so what methylene blue can do here is it can work just like oxygen in the cells to help maintain oxygen related energy production. So in that mitochondria for longer periods of time.
So should we take it before we board?
Before. Yeah,
okay.
Before. Yeah. So typically the protocol that we use, and we have a bunch of protocols on our website. You can check it out. Like just look up jet lag at Troscriptions, and you can see the best way to do it is to start off with methylene blue before you get on the airplane, about 4 hours before. And then depending how long your plane ride is, you will take more methylene blue while you're on your plane ride there, wherever you're going, because it's going to help you on the airplane, right? It's going to help you make more energy effectively. It's going to help decrease inflammation. It's going to protect your body from being under more radiation stress, because you're closer to the sun. So you get more radiation exposure on an airplane too.
I never thought about that.
Yeah.
Even inside the plane?
Even inside. This is why pilots, stewardesses, or flight attendants, as we call them now, they have a higher risk of cancer because of being on airplanes.
No way.
Yeah, because of the radiation exposure, because the time zone shifts too.
Of course.
Because you're always on time zone shifting. So you can use methylene blue as a way to support mitochondrial function while you fly. So you're going to feel better when you get to your destination. Your jet lag is going to be better because you have been supporting your mitochondria the whole time. The other hack for this, if you want one, is to live in a place like I do in Colorado, where you're already starting off at 5,500 feet where I live. Yeah. And so I go on an airplane. That's not a huge amount extra altitude for me. So, and then I'm usually going to a place that's at sea level. So I feel like $1 million when
you guys are cheating. You guys are cheating.
We're cheating. That's why people come train up here though too, right?
I was going to say, I remember my military days. There was this thing called the Army 10-mile race, and they do it every year in DC, and it's 10-mile race. All units from the Army do it. And year after year, man, we would just lose all the time to the damn guys from Fort Carson, Colorado. Because they're training up at like 10,000 feet already. And meanwhile, I'm down there, sweating my ass off in San Antonio, Texas, or wherever I was, and it's an unfair advantage. But that's honestly ultimate biohack right there. You're starting off at that higher elevation, getting used to lower oxygen.
I miss sea level. Let me be clear. I do. When I go back to the ocean, I'm like, oh, I do miss this. But that advantage will stay for about 3 months or so until your body reacclimates to being at sea level, and you won't have that advantage anymore. So It's about 90 days for your red blood cells to build up. And that's one of the major things that happens when you're at altitude. You have more red blood cells around to carry more oxygen. And so, but look, an easy way is to take some methylene blue before you travel. And it's a great way to support the mitochondria and support that hypoxic stress that you're getting immediately when they close the cabin door. So for my high flyers, that people that are on planes all the time, that doing big meetings, methylene blue is great because it's not a stimulant. It's not going to give you energy like you're feeling like you're on like a bunch of caffeine or something like that. It's going to give you just sort of this rise of energy where you just feel like you're more elevated. You have more sustained energy for a longer period of time. So you don't feel, it's like, sometimes it could be one of those things where you look back at your day, you're like, wait, I didn't get tired in the middle of the day. I didn't.
Right. It's one of those things you don't fully realize or even appreciate until after the fact. You're like, wait a minute, something was different. I'm nowhere near as tired, mentally, physically, emotionally, spiritually than I used to be.
Yeah, just something. And some people do feel that significant energy as they're going throughout the day. But a lot of people, they'll feel like, I felt different. I don't know. And then I look back in the day like, oh, I didn't get so tired. My mood stayed stable. I didn't feel like I was wanting to kill my children when they came home screaming after school or whatever it might be. Like it's something where if you have a little bit of awareness there, like it's actually pretty impressive. And it's that clarity and sort of a very clean burning type of energy because it gives you that energy production, but also that detoxification at the same time. And that's really the key sort of across this whole spectrum of health. If you're super sick and chronic complex medical illness, autoimmune issues, and long COVID or fibromyalgia, chronic fatigue, you have mitochondrial dysfunction that's, pretty significant. But on the other end of the spectrum, if you're overtraining and you're not getting enough recovery and you're, that sympathetic spiral, as an athlete, you're not getting enough mitochondrial support either. And you may be surprised, like taking a little bit of methylene blue, you're like, wow, I feel so much better. My recovery is better. Oh, shocking, because your mitochondria had more support. And even though you didn't sort of break the spiral from the sympathetic side, you actually started breaking it on the mitochondrial side, right? And that's kind of cool, right? Where and that's where the spiral is so interesting. But you have to break it on both sides, on that sympathetic activation and on the mitochondrial side too. But you can give people a glimmer of how it can feel to not be overactivated. You can give a glimmer of people how they can feel when they have more energy and they have more detoxification capacity. So I think that, I know it's very blue and it's very, very unusual to have something that looks that blue, and it does make your urine blue too. But methylene blue has these really fantastic ways of supporting mitochondria, and really on both sides. The other thing that I just want to mention here is that, quality is super, super important, because methylene blue is not something that comes naturally from the ground. It is made in a lab. It's been made that way since its beginning. And if you make it incorrectly, you can get it contaminated with heavy metals like lead, mercury, cadmium, and arsenic. And there's a lot of what looks like pharmaceutical grade methylene blue on the market right now that is actually contaminated with heavy metals, unfortunately. And in addition to that, like most of the liquids and even most of the other companies that we've tested on the market, the potency is also an issue, which means that what it says on the label is not usually what you're actually going to find in the bottle or the tablet.
What should someone be looking for should they choose to, supplement with a methylene blue? Are there certain things like, oh, yes, this means it's a good option, and yes, this means I should probably not use this version?
So the first designation that's really important is something called USP. USP is what is a designation for pharmaceutical grade. The second is that there should be a certificate of analysis that shows there's low heavy metals or no heavy metals. And there should be a certificate of analysis that shows that there is the potency, which is the amount on the bottle that says you're taking X amount every single time, should be exactly that or very close to that within a certain range. That's what's called potency. So for example, if it says it's 10 milligrams every time you take a capsule or a troche, then it should be 10 milligrams that they're actually finding when you're testing to see exactly how much is in that actual tablet or troche. But the problem is that, we've tested a lot of these things on the market, and the liquids especially never meet their potency claims, meaning that they're always less than what they say. So if they say you're getting 10 milligrams in every dropper full, very likely you're getting 5 to 7 milligrams. So it's significantly less potency. And then even the tablets that we've checked as well are an issue. And then the other piece is the purity side, the heavy metals, and many of these have higher heavy metals than they should, even if they have like a USP designation. They're coming with a clean certificate of analysis. And you mentioned creatine earlier, which is a good example here. Unfortunately, many people are getting ingredients from other countries, which is fine. Okay, China, India, Japan, Korea. They're getting ingredients from these places, and they're getting, with the ingredients come a certificate of analysis that's supposed to be an independent verification of that particular product that you're getting is what they say it's going to be. But unfortunately, a lot of those certificates of analysis are forged. They're coming from a independent lab that's in cahoots with the actual ingredient manufacturer. And the creatine gummy scandal, I don't know if you've heard about this recently.
Oh my God, yeah. Creatine gummies, yeah. Talk
so
about a rise and a fall.
With zero creatine in them, right? But the thing is, you would get if you go to some of these manufacturers and ask for their certificates of analysis, they'll show you that they have 5 milligrams of creatine per gummy coming from their manufacturer. But the answer, unfortunately, is that this has all been forged along the process. So it's very difficult. This is not even just for methylene blue, but methylene blue is important because of the potential contamination. It's for almost everything out there. You have to be so careful about what you're getting. And so what I always tell my patients and people, that are listening here, I would implore you this as well. Please do not buy your supplements from Amazon. I know it's the easy place to do it, but you don't really know where those supplements are coming from. There have been millions and millions of dollars worth of counterfeit supplements from your favorite brands that have been on Amazon that have been taken out of their warehouses. Okay. And then also, supplements don't have to be regulated. They're not regulated like pharmaceuticals. And so, at our company at Troscriptions, for example, we regulate ourselves like a pharmaceutical company. So not only do we get the certificates of analysis from the manufacturers, but we also do another independent test when things come to the United States.
And you all are actual medical authorities. You are medically practicing providers. Yeah.
We're the only company that has a methylene blue product that has clinicians that are part of its founding or its medical
That's
directing team.
crucial to point out again. Absolutely. Scott, I want to ask another question here, kind of getting towards the end a bit. With methylene blue still, what about potency? Or no, excuse me, timing, solubility, and is there an effective dose? So with timing, I think I heard you say 4 hours before we're going on a plane. Is 4 hours that sweet spot before we want to use it for any purpose, or is it, event particular? So for timing, and then for effective dose, are we looking for, like with creatine example, all the science will tell us about 5 grams for every human daily is that sweet spot. Anything less, we don't really get the bang for the buck. Anything more, diminishing return and, even unwanted benefits or unwanted side effects. What are we dealing with methylene blue here? And also with solubility, does it need to be taken on an empty stomach? Is it like fat soluble vitamins? We need to take it with food, or what are best practices here?
Yeah, so the solubility of methylene blue is actually fantastic. And that's why you can take it as an oral lozenge. You can swallow it. And so you don't have to have a blue mouth if you don't want to. But if you're going to swallow it, we typically recommend you swallow it on an empty stomach because it's going to be absorbed faster. So it's one of the really unique ingredients out there where most things get what's called less bioavailable as they go through your stomach and through your small intestine and your liver. Like, for example, I always use the example of NAC. NAC is about 10% bioavailable. So if you take 100 milligrams of NAC, you're getting only about 10% of that, about 10 milligrams actually in the body itself. So most supplements are like that. And the troche form that we use at Troscriptions is great, actually. It's a buccal lozenge that goes between upper cheek and gum because you're bypassing metabolism in the liver for that reason. But methylene blue is actually a distinguished ingredient in that you can actually use it as a buccal troche, or you can swallow it. You get the same mitochondrial benefits. It's just going to be faster if you dissolve it in the mouth, and you will have a blue mouth if you do that. So just be aware of that because methylene blue, again, is extremely blue. Shockingly so if you're not used to it. But to answer your questions about when it comes to the timing and the dosing, these are really great questions that I appreciate you asking. From a timing perspective, the half-life of methylene blue is about 4 to 6 hours. So from an optimal effect perspective, the ramp up periods between 30 minutes and an hour. So I have people typically wait about 30 minutes to an hour before they start doing their activity, especially from a performance perspective, before they start taking their methylene blue. And so that's typically a good time frame. About 30 minutes to an hour before you're going to do it is usually pretty good. And then about 1 to 2 hours is great. It's kind of like your peak is going to be between 1 and 2 hours for most people. And then it's going to start to come down from there a little bit. But the half-life, again, is between 4 and 6 hours. So from a timing perspective, if you're going to use it as a troche, you can do it within about 15 to 30 minutes. If you're going to swallow it on an empty stomach, within about 30 to 60 minutes after taking it, you can go ahead and do your performance-related task or your other, energetic task, whatever that might be, physical, cognitive, whatever. And then the other thing that might be interesting to mention here too is that I often pair methylene blue with red light as well. Red light, a nanometer wavelength, about 680 nanometers. So red light itself, it actually synergizes with methylene blue in the same area in the mitochondria where they both can work together to increase your energy production. And so combining methylene blue with red light is a fantastic synergizer for increasing energy, just increasing performance overall.
Well, just
and so
taking our methylene blue and then sitting in front of a red light device, red light therapy, red light sauna.
Or going in the sunlight too. Yeah, that's the other option.
Oh, wow.
Sunlight obviously has
sunlight. Yeah, what a thought.
Yeah, sunlight has red light too, right? And so I have what I often a great stack for performance is you take your methylene blue, and then if you've swallowed it within about 45 minutes later on average, go in front of your red light panels or go out in the sunlight, go for your hike. You're going to feel fantastic. And your performance is going to go up dramatically if you're using it from a performance perspective too, especially on the endurance side. And then I think also, again, we're working on it, but that anaerobic heart rate elevation where you don't have to go down as far to get the recovery on your heart rate between sets when you're doing, hard strengthening work too. And so we're seeing this, like you're seeing this and I'm seeing this in my patients, seeing in my friends and my colleagues too, that we're working on it. And so that is a great, great combination. And even just as a side note, and we're going to talk about this in a minute, you can actually use higher doses of methylene blue with higher strength red light in combination as a fantastic anti-infective as well.
Interesting.
From there, we talked about the timing. So about 30 minutes if you use it as a troche, 45 minutes to 60 minutes if you're going to use it and swallow it. The peak of methylene blue is going to be between 1 and 2 hours or so. So that's kind of where you're going to go and think about doing your cognitive tasks, your physical tasks, when you're going to be on an airplane or really going to be on sort of, high energy mode, right? And then when it comes to dosing, the dosing is super important here. Okay. We've talked about it a little bit throughout the podcast, but when it comes to dosing, I always want to start people at low doses unless they have an acute issue. If you have an acute infection where I have acute viral infection, bacterial fungal infection, then higher doses of methylene blue around the 50 to 70 milligrams or above can be extremely effective as an anti-infective, sometimes on its own and sometimes in combination with other antimicrobials, other things like that. But for the most part, lower doses starting at 4 milligrams or 8 milligrams. So our Just Blue troche, for example, is 16 milligrams of methylene blue. You start with a quarter of that, and then and take it for 3 days in a row at a quarter. If you don't feel any better, then start increasing it by a quarter every 3 days and go to 8 milligrams. How do I feel on this dose? Is my energy better? Is my capacity better? Is my mood better? Is just everything kind of feeling better? If it's not, then keep going and go to 12 milligrams, then go to 16. Usually somewhere between 8 and 16 milligrams. For most people, they're going to see a significant benefit in their overall performance, both physical and cognitive. And that's because it's really supporting that mitochondria at those doses. Now, and some people need to go a little bit higher than that if they have more mitochondrial needs. But for the most part, these lower doses are really great at supporting both that energy and detox capacity. Okay. The problem with a lot of things out there too, Chase, is that a lot of the methylene blue products out there, they have too high of a dose of methylene blue in them, actually. I
was just going to ask, is there a point of diminishing return with methylene blue or even, overdose, to use the term lightly here?
Yeah. So what it comes down to is that once you get to a certain dose, you start creating more stress in the system. Typically that's around the 50 to 70 milligram mark, because that stress is what's actually killing infection too. And that stress is that hydrogen peroxide production. Okay. And so once you get to about that milligram per kilogram, that's when you start putting more stress on the system to kill infection, but that also causes potential stress on the system. And if you have a system that doesn't have a lot of capacity to address or to compensate for that stress, and that's your antioxidant system, then you may not be able to really be able to balance that. Now, if you get to above about 3 milligrams per kilogram, which is a super high dose of methylene, but we're talking like 210 milligrams or above orally, like that's when it becomes not supportive at all to the system, where it can also just cause pure stress to the body. And you don't want to use those doses unless you're under significant medical supervision and only in like dire life-saving emergency kinds of times.
Poison is in the dose, as they say, right? Yeah. With everything, with things that are bad for us, and hell, water, too much water can be a bad thing as well.
Yeah. And then I just would also say with methylene blue, like there are certain potential interactions you have to be careful of. And so if you're on high blood pressure medication, you don't want to take methylene blue because it can increase your blood pressure. You can do it potentially with a healthcare practitioner working with you very closely, but not on your own. Okay.
Yeah. Who shouldn't use methylene blue?
Yeah, so that's one group. The people with high blood pressure got to be careful. You can use it, but you have to be very careful about your dose and watch your blood pressure very carefully. Again, with healthcare practitioner supervision. If you're pregnant or breastfeeding, you shouldn't take methylene blue as well. The other thing about methylene blue is that it does increase serotonin, dopamine, and norepinephrine, especially serotonin and norepinephrine at lower doses. It's dose dependent, so low doses of methylene blue is going to do it a little bit, and then higher doses is going to do it more. And then that dopaminergic thing is going to happen a little bit at the higher dose too.
Real quick, I think someone might be hearing that and go, "Oh, that sounds nice. Why wouldn't I like more dopamine, serotonin?" Please highlight why this is actually not a good thing, especially long term.
So actually, it can be okay for most people to have this, but if you're already on a medication that's increasing serotonin, like an SSRI or SNRI, which like the newer generation of antidepressants, then the combination can be uncomfortable. And at the worst, at very high doses of methylene blue, especially in the IV, in combination with these drugs, it can cause something called serotonin syndrome, which is very, very dangerous. Now, low doses of methylene blue orally in combination have never been shown to do this, but you have to be aware of it and work with the practitioner closely just in case. But in addition, things like Adderall and other, stimulant medications also increase norepinephrine and dopamine. So if you're on those kinds of medications, like you have to be careful because again, there can be an interaction where you're getting more dopamine and norepinephrine around that may be uncomfortable. And so in those cases, I really do recommend you work closely with your provider to make sure that, that you're okay taking methylene blue, or maybe considering, a weaning protocol if it's done safely over time off of some of those pharmaceutical drugs. It's also important to know that your urine's going to turn blue. We talked about that. And then some people can get detox symptoms when they start methylene blue because, again, you have to deal with some of that oxidative stress that's been built up over many years. And so, but the key with that is starting off at low doses and then just slowly over time increasing the dose. And that's when you really don't have that many issues. So pregnant, breastfeeding, if you're on SSRIs, work with a practitioner. If you're on high blood pressure medications, work with a practitioner. Really, if you're taking any medications, you have to be aware that there could be interactions that you're not aware of. And so work with a practitioner, or at least let a practitioner know if you're going to be taking any supplements or any other, medications that they don't know about, just as good practice.
One last question I want to ask you about methylene blue here is, when looking into this personally, asking people I knew, or even trying these products here and just looking to the literature and hell, even just social media, I feel like methylene blue is still pretty divided. I talk to people, I see people, I watch content, listen to podcasts where they're like, it's all the things that you've been talking about, and people love it and swear by it and are happy to share anecdotal evidence, clinical evidence, and then others like a recent guest of mine, Dr. Nathan Bryan.
Oh, I can talk about Nathan.
Yeah. So he's all team nitric oxide, and he kind of, my words, not his, poo-poos methylene blue a bit. So why is there such a divide when we're hearing all of this supposed amazing benefits from your clinic and your work and your research? Why the divide? Is it good or is it not?
I think the big issue here, Chase, is the dosing, is that people seem to sort of bring everything, conglomerate all of the things about methylene blue as being XYZ, but they don't remember that the dosing is the key. Low doses are super, super safe and super, super supportive, but higher doses can be dangerous for sure. And I could address a couple of them briefly.
Please. The
one that Nathan Bryan and he and I have had this conversation before. Nathan, I think he's a really great great researcher. He's not a clinician. Okay. He doesn't see clinical patients. And I've been doing this a long time now. And I work with nitric oxide, which I'm a big fan of. I take nitric oxide myself in various supplementation, but low doses of methylene blue do not have any detrimental effect on your normal production of nitric oxide. Now, you have abnormal production of nitric oxide that can happen in circulation in the bloodstream when you have an infection, when you have trauma, when you have stress. That type of nitric oxide is actually neutralized by methylene blue at almost any dose, which is very, very cool. But higher doses of methylene blue, over about 1 milligram per kilogram, maybe, but definitely over 2 milligrams per kilogram, is going to cause a downregulation of your endogenous supply as well. So in my patients, if I'm using higher doses of methylene blue over that milligram per kilogram, I am using nitric oxide support at the same time. But the problem is not so much that for so many people, like the nitric oxide that gets produced by infection, by trauma, by stress, that's what causes low blood pressure. That's what causes chronic pain. That's what causes chronic inflammation. So if you can neutralize that inducible nitric oxide is what it's called, you can see fantastic benefits in people. And I've seen this time and time again. So the nitric oxide discussion is all about dosing of methylene blue. Lower doses between 4 and 25, probably up to 50 milligrams, but definitely just below that, do not have an effect on that endogenous supply of your nitric oxide that's so important for your mitochondria, for your cardiovascular health, for your brain health. Okay. That's one of the big things there. So I know Nathan well. I like him. I think that his research is great, but I think he's, like many people, forgetting that there's a dose dependency here. And there's also been controversies on other things as well. One of them was an article that came out earlier this year that if you take methylene blue, your brain is going to turn blue. And
is that can't be true? Is it true?
It is true if you take huge amounts of methylene blue IV. But normal amounts of methylene blue will not do that. Methylene blue is going to concentrate in the mitochondria to have your mitochondria turn mildly blue for a short period of time as it's cycling between various states, which is, outside the realm of biochemistry here. But in the end, your mitochondria do not remain blue. It's just a short period of time where the methylene blue goes in there, concentrates, and then leaves.
Well, even if they do, is that a bad thing? If we have blue mitochondria, if we have a blue brain?
For a short period of time, having methylene blue in there is not a big deal, right?
Okay.
But what they did is they did autopsies on people that had died taking high doses of IV methylene blue because they were using this IV methylene blue as a rescue to try to prevent them from dying. Cardiovascular collapse.
So it was like a last grasp, last straw. Okay. Yeah. So they're like, let me just try anything at this point.
Yeah, exactly. Yeah.
Okay.
So
That's kind of, that's a little unfair in my opinion.
That was a totally great shock type of blog that got a lot of press because it was great clickbait because they showed blue brains on the images, right? There's also been some talk and controversy that the only benefit you're getting from methylene blue is because you increase serotonin, norepinephrine, and dopamine, and has no effect otherwise, and that's why people feel better. And this is all Paul Saladino stuff. And Paul was talking about how if you that's all that methylene blue is doing. But he also says that, most people are relatively healthy, and that's bullshit. Most people are not. Most people, 94% of US Americans are not. And that's why methylene blue could be so powerful in that group of individuals. And we talked how even in well-optimized people, endurance, travel, performance, those are all potential benefits of methylene blue using them periodically, right? And so, Paul's comment here is, again, coming from somebody that's never seen patients in clinical practice, and also not really understanding the dose dependency here as well. Well, he would talk about the only benefits of methylene blue are, if you have these, serious diseases, but he would not really, even the studies that he quoted in this YouTube that he did, which I went through tit for tat for each of his points. Yeah. The only study that he actually quoted was one that was the equivalent of like 5 milligrams per kilogram IV of methylene blue. So it was like not even remotely close to human.
And which most people are not going to be doing. Most people. No, by any means.
Don't, like the indication for IV methylene blue is very, very small. Most people can take oral methylene blue and get the same benefits, if not better, because there's less risk. IV methylene blue, if you are taking IV methylene blue, you have to be much more careful about blood pressure, about serotonergic drugs, about antidepressants and things like that. So that's the other controversy. And I think the other major one, like maybe to finish it off, would be that you shouldn't take methylene blue if you're well optimized, if your mitochondria are normal, because they're going to make them function worse. There's no clinical evidence of this, number one. And number two, I'm not asking or recommending that somebody that's well optimized take methylene blue every single day. I'm saying they should take it periodically when they have more stress. They have a big day at work. They have travel. They're going to do a big endurance day at the gym. They're going to do a big heavy lift at the gym, right? And then see how it makes you feel and then use it in those ways. And so those are the major controversies. There's probably more, but in general, what it all comes down to in the end is the dose dependence of symptoms related to any stress related to methylene blue. So low doses, 4 to 25 milligrams, super safe, super well tolerated, aside from some blue urine, which is asymptomatic. You just have to be unsurprised when you look at your toilet and go, oh, wow, it's blue.